You see, traditionally, we used to use the surgical technique, which is a great treatment in the sense of you can reduce significant amount of fat from most part of the body and you can tighten the skin at the same time. The big disadvantage, apart from the long recovery for the patient after the major surgical procedure, that patients will definitely have a scar. And sometimes you can hide the scar if you are doing the lower abdomen, but if you decide to do underarm, chin, upper chest, inner outer side, it's quite challenging to leave the patient with the scar. Therefore, in the early 80s, the traditional liposuction has developed, and it became the golden standard technique where you can reduce the fat from any part of the body through a small tiny incision, so the patient will not have a scarring, and truly they will have a far shorter recovery period after the surgery. But with the traditional liposuction, you can only suck the deep loose fat. You cannot suck the stubborn fat which is sitting directly under the skin. And if you try to attempt to do that as a plastic surgeon, you could cause significant indentation to the skin, you could cause cellulite, you will cause irregularity. So the patient will have significant fat reduction and she will look, or he will look great with their clothing, but will be very embarrassed to show their figures to their partner after midnight or go swimming. Therefore, the need for the technology or the technique which would enable us as a plastic surgeon to deal with the superficial fat was needed. And the studies actually started in 1988. The breakthrough came in year 2000 when the SmartLipo was born. And the technique was based on the fact that the surgeon can do a small incision and insert the laser cannula under the skin and go and laser not only the deep loose fat but laser the superficial fat using the light energy. In 2006, I introduced this technology into the UK. We've done hundreds of cases. We had great results in small areas, but it was quite challenging to do big areas of fat or multiple areas of fat. And we didn't have very successful results using the only laser lipolysis technique. That means you fracture the fat and you let it move through the lymphatic system. In 2007, I invented and developed the technique called laser-assisted liposuction, combining both the laser energy, which fractures the fat, coagulates blood vessels, and it does not damage the nerve ending, which is quite important to appreciate, because we can go to an area which, for us as a plastic surgeon, was an approachable area. We couldn't do liposuction or surgical technique in the neck, for example, or underarms without significant side effect. Now with the laser-assisted liposuction, literally you can go to any part of the body under local anesthetic or very light IV sedation, where patients can have fat reduction and skin tightening, and they can go home in the same day, and they can go to work next day and function absolutely normal, going to the gym in a quick time with a great result. And therefore, patients are demanding and asking about SmartLipo and laser-assisted liposuction.